Welcome to the second episode of our Next Gen NCLEX-RN review, and we will be tackling two cases today, so make sure you have a notepad and a pen with you to jot down key test taking strategies. So let's get into it.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions. Practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
To the Q&A. So as you see here, you have a question, a scenario, and your task for this question. And so this is basically what we call as a drop-down table question. Now, if you are not familiar with this test format, this is basically going to have like two columns. So you will see possibly this type. There's going to be suspected reaction if we are talking about a blood transfusion reaction, and then there's that column that will ask you to select that particular answer in a drop-down menu, and this is going to help you gain a point for each row. So basically this is going to give you a chance to select as much as correct answers as you can. And so the total score for the item is based on the number of the correct answers across all the drop downs in the table. So as you see here, we have 3 drop down menus available. So let's get into the case scenario now. It reads, a nurse is transfusing 1 unit of packed red blood cells to a client with a hemoglobin level of 5.3 grams per deciliter. During the transfusion, the nurse observes signs suggesting a possible transfusion reaction. Your task, it says, given this scenario, pair the suspected condition with the most probable initial clinical symptom. So we have suspected reactions, fluid volume overload, we have allergic reaction, and lastly, acute hemolytic reaction. So for each of the suspected reaction, you are going to match this with the specific early manifestation. So here are the following options. For the first row, here are the options: skin irritation, hives and itching, shortness of breath, discomfort in the lower back. And basically the same options are available for the 2 rows, or for the 3 rows rather. So for the fluid volume overload, what would match this one? Well, the correct answer for the fluid volume overload is what? That is going to be shortness of breath, because with fluid volume overload, this is going to happen when the circulatory system cannot handle the additional blood volume from the transfusion. So this can cause pulmonary congestion. And the early sign of this is the dyspnea. There's going to be shortness of breath. And it's because of the fluid accumulation in the lungs. It can lead to difficulty in breathing. You will see that the patient's respirations will probably be in the high 20s or even in the 30s. And other than that, with the fluid volume overload, the client may also end up with higher blood pressure. They're going to end up with higher heart rate. There's going to be crackles on the lungs when you auscultate. So you gotta be attentive to the manifestations here. Now, for the allergic reaction, what do you think would match this one? Well, this is going to be skin irritation, hives, and itching. So the allergic reaction when you are going to give a blood transfusion, this is triggered by the hypersensitivity response to the plasma proteins in the donor blood. And the reactions that you'll expect to see would be the rash, there's that skin irritation, there's going to be appearance of hives, there's itching. And these are usually treated with antihistamines, but if there is going to be a much more severe reaction, this might require the administration of epinephrine. Okay, and most often than not, the severe reactions will require you to stop the blood transfusion right away and disconnect that blood transfusion tubing and make sure that you have a normal saline that is infusing at KVO rate. Now let's take a look into the acute hemolytic reaction. What would match this? Well, of course, we don't have any other options, right? We have only one left, and that's going to be discomfort in the lower back. So what is going on in acute hemolytic reaction? Well, this is a life-threatening reaction, which is caused by the immune response that occurs when the recipient's antibodies will attack the incompatible donor red blood cells. And the discomfort in the lower back, or in some cases, that's basically just back pain, right? That is new. That is non-chronic back pain. This is one of the earliest symptoms, and this results from the hemolysis and also the release of the free hemoglobin into the circulation, and this can eventually damage the kidneys. Now, the other signs that you should expect with an acute hemolytic reaction would be fever. There's going to be chills, hypotension, there's going to be tachycardia, and the presence of dark urine. And this is reflecting hemoglobinuria. And there is possibly going to be shock in severe cases. Now, for this question, I want you to focus on the subject and also focus on the initial clinical finding for each suspected reaction. And you have to focus on the keywords, especially that we are being asked about early findings. And I want you to apply the concepts that you have learned, especially with the pathophysiology, to differentiate the different types of blood transfusion reaction. And so for the fluid volume overload, you need to think of fluid accumulation. And this is going to be manifested mostly as a pulmonary symptom or symptoms. There's going to be shortness of breath. Now for the allergic reaction, think of hypersensitivity. There is going to be skin irritation or rashes. There's going to be hives. There's going to be itching. And for the acute hemolytic reaction, I want you to think of the destruction of the red blood cells. And this will lead to the development of the back pain. And this simply pertains to the involvement of the kidneys. Again, the breakdown of those red blood cells and the hemolysis, of course, this can be filtered into the kidneys, and that's why there's that development of the back pain. So again, I want you to recognize the early signs to help you in detecting the specific blood transfusion reaction.
Before we move ahead, here's something you shouldn't miss. If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's continue with the topic.
Now let's head into our next case study here. This is what we call as matrix multiple choice. So you're seeing here 3 columns. One column is all about nursing intervention. The second one is indicated statement or contra, or it will give you a chance to select if it is a contraindicated nursing action. So with this type of question, this is going to be scored for each row. There is going to be partial credit. And again, this is not going to cause deduction of your correct answers from the mistakes that you have committed. And so for each row in the matrix, consider that as a multiple answer option. And so with, again, a selection of correct answer, this earns 1 point, while an incorrect option will be a 0, right? And so your total score in this test item is going to be based on the number of the correct responses across the entire matrix. And so here we have 5 rows. And so if you correctly select 4 out of 5, your score for this question would be 4 points out of 5. And so you need to treat each row as a separate multiple choice question, and you have to evaluate it carefully. And do not misinterpret or do not rush misinterpreting just one row, because this can cost you several points. So let's get into the scenario here. It says, the nurse is caring for a pregnant client at 32 weeks gestation who was admitted due to the preterm labor with suspected premature rupture of membranes, or PROM. The nurse's notes says, at 10:00 hours or 10 a.m., the nurse received a report indicating that the lecithin sphingomyelin or LS ratio is 1.6 to 1. At 10:30 a.m., the fetal heart rate is 132 beats per minute with moderate variability. Now your task here, based on this information, what actions should the nurse take? For each action below, click to specify whether it would be indicated or contraindicated. Now let's look into the first intervention, routine prenatal care. Is this indicated this time, or is it not? Well, go back into the case here. Our patient has suspected premature rupture of membranes at 32 weeks gestation. And looking into the other information here at 10 a.m. and 10:30 a.m. So for this row, the answer is contraindicated. Well, why is routine prenatal care contraindicated this time? Well, it's because routine prenatal care is typically provided to low-risk pregnant clients in an outpatient setting. But in this case, the client has preterm labor. And of course, the PROM, the patient is at 32 weeks gestation. This client requires inpatient monitoring to assess for the complications. They might end up with an infection, right? Because of the PROM. There is a possibility that this mom will end up with an umbilical cord prolapse issue and the possibility of a preterm birth. So again, routine prenatal care is not appropriate for this client. Now, what about the second row? Administration of prophylactic broad-spectrum antibiotics. Is this going to be appropriate, or is it indicated or not indicated? Well, take note that the PROM increases the risk of chorioamnionitis and possible infections due to the prolonged exposure of the amniotic sac to the external bacteria. And of course, the use of the broad spectrum antibiotics has been shown to prolong pregnancy. And so this is going to be indicated because with the administration of the prophylactic broad spectrum antibiotics, this can also reduce neonatal infections, and it will also decrease complications like intraventricular hemorrhage and the possibility of respiratory distress syndrome in the baby. Now, what about the third row, continued inpatient monitoring? Why is this? Is this going to be indicated or contraindicated? Well, the answer here is indicated. We're going to implement conservative management for this client who has a PROM at 32 weeks to prolong their pregnancy and also to reduce possible complications. And this client requires hospitalization to monitor for infection, especially. You have to watch for maternal fever, the tachycardia on the fetus, or maybe possible signs of labor progression, which would really necessitate the continued inpatient monitoring. Now let's look into the fourth row, which is the administration of corticosteroids. Now I want you to go back into the data here about the LS ratio of 1.6 to 1. Okay, this indicates that the fetal lungs are not yet fully mature. Now, I want you to remember that maturity is achieved at 2:1. So pay attention to this one. This is a huge red flag. And so the correct answer here is the administration of corticosteroids. It will be indicated. We're going to expect to administer the betamethasone or dexamethasone, which is given to accelerate fetal lung development. And this will reduce the risk of neonatal respiratory distress syndrome in case of preterm delivery or if it becomes unavoidable. Now, let's look into the fifth row. It says immediate preparation for surgery. Is this indicated or contraindicated? Well, the answer to this one is contraindicated. Why? Because preterm delivery is typically delayed if possible in order to allow fetal lung maturation unless there is fetal distress or if there is infection or disruption of the placenta. And in this case, the fetal heart rate is at 132 beats per minute with moderate variability. There are no immediate complications that will require emergency delivery. And so continuing to monitor and also making sure that the pregnancy continues under close monitoring is done this time. Now, what you want to do with this test question, I want you to identify the abnormal findings first. You have to recognize that there is already suspected PROM at 32 weeks gestation. This is going to require careful management. And also pay attention to the LS ratio, indicating that the fetus is not really developing yet as far as the lungs is concerned. So this is going to make preterm birth very risky. And also pay attention to the heart rate of 132 beats per minute with moderate variability. It suggests that the fetus is currently stable this time. And I want you to also understand the goal of the management, that if there is preterm labor before 34 weeks, it is usually managed conservatively to prolong the pregnancy and also to allow time for fetal lung maturation. And there is something that we can do for the prevention of infection with the use of the broad spectrum antibiotics and also the administration of the corticosteroids to allow fetal lung maturation. So these are the key priorities, and also, of course, with a continued inpatient monitoring. All right. And I want you to carefully distinguish between indicated and contraindicated actions. So all those actions that are indicated can help manage the condition safely. And for those contraindicated options, these are the actions that could harm the client or they are inappropriate, such as routine prenatal care, and there is no insufficient immediate delivery needed this time. There's no need for this action. And don't forget to prioritize safety and the evidence-based practices that you're going to employ in this scenario. Again, preterm delivery should be avoided unless there's maternal or fetal complications. And you have to avoid rushing into the delivery of the baby unless the mother or the fetus show any signs of distress. And so that is the end of our Q&A today. I hope this presentation helped your NCLEX prep, and I'll see you again in the next episode.